I made a reference a while ago about, that 17-year-old horse that's pretty lethargic and it's probably been a grandkid's horse and you've stuck the grandkids up on it and it just kind of mopes around in the yard. Once we start treating those horses, you might want to watch, because that might not be a grandkid's horse anymore, because sometimes you'll put them on it and they're feeling good and they end up in the next county. So we do not eliminate the disease in the pituitary of the horses with PPID. We manage it. PPID itself is just an issue with the pituitary specific part, the pars intermedia, and there's a dysfunction. It is a neurodegenerative disease. We look at clinical signs and what do these horses actually look like when they present, right? And so what are they showing us? And when we look at clinical signs for PPID, the number one thing that most horse owners and myself as a veterinarian will notice is a lack of hair coat shedding compared to other herd mates, okay? In the early part, it may only be regionally, maybe just on the side of the neck, maybe in the jugular groove. You may just see it right over the croup. You may see it on the backs of the legs or something like that. If we look at probably the most predictive clinical sign of being PPID, it would be delayed shedding. Another bigger one is we'll get a loss of muscle mass, but typically in the earlies, it starts right over the top line. That's where we'll see that. And occasionally a history on that, maybe a horse owner will say that I've had to use a different pad this year. I've had to do something. The saddle is not right. Something is different. And sometimes if something changes slowly, we don't notice as much as a horse owner. But if we step back and really look, we can notice that loss of top line. What I've always asked horse owners to do, and especially now, if you've got that iPad, take pictures of your horse, maybe twice a year, spring and fall, but tend to take that picture in the same place at the same time of day. So we're kind of getting the same look of the horse, right? Not only that, but what's their horse's weight? Not everybody has scales at home. Weight tapes are easy. Sometimes they'll be off just a little bit, but if we do it the same way, then we can record that and keep that, twice a year. You don't really have to do it a lot more often. So we can review that for a second and see if anything we pick out or we talk together and we're kind of keeping up with this horse over time. So I think it's important to do that, especially with PPID. If we can diagnose these horses earlier before we get to these really advanced stages, and then we're kind of playing catch up at that point. We look at how our horse is diagnosed with PPID. There's three components, and I'll live by this. It's a history from the horse owner. It's going to be a physical exam of the horse that I'm going to conduct. And then if we're seeing clinical signs and we have a history and a reason to test, then there's diagnostic testing, okay? And we can usually get results in 3 to 5 days. I'm Dr. Steve Grubbs, and together with your veterinarian, we can master equine health.